The content of this podcast is provided for general informational purposes only and is not intended as, nor should it be considered a substitute for professional medical advice. Welcome to Itchy and Bitchy, a podcast that provides answers to your many unanswered health questions. I am Karen Nickel, family nurse practitioner, and today I'm going to talk to you about vaginal spotting. If you are thinking, I no longer have periods, this doesn't apply to me, I will be talking about spotting in menstruating, perimenopausal, and menopausal women, so stay tuned in. Before I get started, I want to thank all of you who joined me for a research call to help me develop the best possible online course for perimenopausal women. I plan on having the course ready for release early in the new year. I will be letting you know when it is ready and how to connect with me about the course. Vaginal bleeding that happens at any other time than during your period is often referred to as spotting. When this happens, the bleeding is often shorter and lighter than your regular period flow. Sometimes cramping may also be present depending on the cause of the bleeding. While bleeding between periods can be inconvenient and frustrating, it isn't typically a cause for concern and is usually treatable. However, there are times when spotting can be a sign of a serious condition. And spotting can happen for a variety of reasons. And let's start with something I talk about all the time, perimenopause. As you have heard me say before, this stage of life most often occurs between ages 35 and 50. These are the years leading up to the stage called menopause. I'll remind you that signs of perimenopause can include fatigue, foggy thinking, irritability, decrease in sex drive, weight gain, sleep problems, hot flashes, and night sweats, to name a few. During this time, hormone levels can fluctuate a bunch. Estrogen is swinging up and down, which causes period changes like irregular cycles, change in heaviness of flow, and skipped cycles, but can also include spotting. But unlike flow changes and skipped periods, spotting is not considered really a normal part of perimenopause and should be brought up to a provider so it can be appropriately evaluated with labs, a physical exam, and possibly a transvaginal ultrasound. I often see women for this problem, and they are not happy about the situation. If they are on HRT, usually an adjustment in the dose will correct the problem. If they are not on HRT, I will often recommend supplements like over-the-counter DIM, which is diindolylmethyl, to help control some of the estrogen fluctuation. Jumping to the other end of the life spectrum, pregnancy can also be a cause of spotting. As I am sure most of you know, your period stops when you're pregnant, but it's actually fairly common to experience some spotting, especially early in pregnancy. Studies show that about 1 in 4 pregnant women have spotting during the first trimester, which is the first 12 weeks of pregnancy. When a fertilized egg implants into the uterine lining, it can cause spotting. Early spotting might also occur because our body is creating more blood vessels in the cervix, which makes it more susceptible to bleeding. While bleeding later in pregnancy can be cause for concern, bleeding early in pregnancy often isn't. Still, it's important to contact your healthcare provider who is caring for you during your pregnancy if you notice bleeding at any point during the pregnancy. Growths in the uterus are another common cause. We can get 2 types of growths in the uterus. Uterine fibroids are one type, which are pretty common, and a lot of you know about those. And the other is uterine or endometrial polyps. And both of these can cause spotting that is sometimes accompanied by cramping. These masses are typically small, non-cancerous, I'm going to repeat, non-cancerous, and otherwise not very bothersome. Both are more likely to develop as you age, thank you, and tend to be fueled by estrogen dominance, which I have talked about before. This is when your estrogen levels are high and progesterone levels are low. Estrogen stimulates cell growth in the sex organs, and progesterone slows growth of those tissues. So when we have high estrogen, we are more likely to develop fibroids and polyps, and every time the estrogen spikes during the cycle, it's like throwing gasoline on the fire, and the fibroids and polyps increase in size and can become troublesome. Also, if your progesterone levels are low, there is nothing to slow that growth down. This hormonal imbalance is most often seen in, guess what? Perimenopause. There's that word again. Women can develop polyps inside the uterine lining and on the cervix. Since polyps bleed really easily, a polyp on the cervix can trigger spotting after intercourse. This is usually a small amount of bright red bleeding for a day or two after intercourse. And this type of polyp can be easily removed in the office. When I see a cervical polyp during collection of a pap smear, I just go ahead and remove the polyp so it doesn't become a troublemaker. I always send the polyp off to pathology, even though it is very unlikely to be cancerous. Usually working to balance hormones can help spotting that is caused by fibroids or polyps. If that doesn't do the trick, surgery can be considered if the symptoms are severe. Using hormonal birth control like the pill, implant, injection, or intrauterine device, IUD, is a common cause of spotting. With IUDs in the pill, spotting will typically get better in 3 to 6 months after starting these forms of birth control. Spotting with implants and injections may or may not decrease with continued use. That's the tricky part of using the progestin that's either implanted in the arm or injected. Some people have recurrent spotting once they start this form of birth control, and the injection lasts 3 months, and the implant lasts 3 years, and the spotting could last the entire duration. And making those med changes to stop the breakthrough bleeding cannot be done quickly and could involve removal of the implant. This side effect of hormonal birth control is generally not harmful, just darned annoying. If it's particularly bothersome, check with your healthcare provider for treatment options, including changing birth control methods. Of course, you can take ibuprofen for the cramping or adding short-term estrogen treatment to get that bleeding stopped. There are some underlying health conditions that can disrupt hormone levels and cause spotting. Hypothyroidism, which is when the thyroid gland is not producing enough thyroid hormone, and polycystic ovarian syndrome, PCOS, are two underlying problems that often interrupt ovulation, which causes hormonal imbalances that can lead to spotting. Thyroid, female hormone, and pituitary hormone levels need to be checked, and if you are diagnosed with one of these conditions, they can be treated with medication to help regulate hormones and reduce or eliminate the spotting episodes. While we're talking about ovulation, some women have spotting during ovulation. This happens mid-cycle when the ovaries release an egg. This type of spotting lasts for a day or two, and often people will have cramping as well. Oh, and of course, there are even more reasons for breakthrough bleeding, and I will share those after this break. My listeners know that I always recommend skincare products that are clean and cruelty-free. Osea has been doing that for 25 years. Seaweed is their hero ingredient because of its endless benefits, including anti-aging. You all know another thing that I love, and you should love too, is that they are climate neutral certified and their products are clinically proven to work. I use their Undaria algae body oil faithfully every day. And I've told you before that Undaria algae body oil is the only product I have used that turns my rough, dry skin into smooth, moisturized skin. If you prefer a cream, they also have this product in a body butter form. Yay! We are heading into the holidays, and for a limited time, Osea's bestseller minis collection is available. Not sure what to give someone or need some stocking stuffers? This is for you. You can get a 6-piece set of luxurious skincare and body care favorites in convenient and adorable travel size that includes 3 best-selling face products and 3 best-selling body moisturizers, including their TikTok famous Undaria algae body oil. Oh, and it's packaged in a beautiful box that's easy to gift wrap, but I think once you see the box, you'll realize you don't even need to wrap it. For a gift that will impress, check out Osea's bestseller minis collection. Right now, my listeners get 10% off your first order with promo code ITCHY at OseaMalibu.com. You'll even get free samples with every order, and orders over $50 get free shipping. That's 10% off Osea, OSEA, Malibu.com, promo code ITCHY. Welcome back. It's fairly common for women to notice spotting after sex. Up to 9% of women are believed to experience this, and this can happen in perimenopause or menopause when the vaginal walls are thin and dry. If you have endometriosis, you are more likely to have postcoital bleeding. Cervical polyps, as I mentioned before, can bleed very easily when touched, so they can cause bleeding after intercourse. Also, if you have a vaginal inflammation, most commonly due to an infection, intercourse can make those tissues bleed. Any type of injury to your vaginal area can prompt spotting as well. Sexual trauma, of course, can be a cause, but routine activities like getting a pap smear or having rough sexual intercourse can also lead to bleeding. If spotting continues more than 2 or 3 days, or you have pain with the spotting, you need to be evaluated by a medical provider. Several types of medications can cause spotting. Hormone therapy, as we discussed, either birth control or hormone replacement, will trigger that, especially if you've missed a few pills. Tamoxifen, which is a medication for early stage breast cancer, can also cause some bleeding because it can thicken the endometrial lining, the lining of the uterus. Blood thinners can cause bleeding because it makes you bleed more easily. So we see more bleeding sometimes with people on blood thinners. Antidepressants, including SSRIs like Prozac, Paxil, and Zoloft, and antipsychotic drugs like Abilify, Rexulti, Seroquel, Latuda, Haldol, and Safris. All those meds can trigger spotting. One-time use emergency contraception pills like Plan B can cause spotting because they're designed to make you bleed. So stands to reason that you might bleed if you take one of those pills. Use of corticosteroids can cause breakthrough bleeding. I see this all the time, especially in menopausal women. When I am seeing a woman for this problem, I always ask if she has had recent dosing of a steroid like prednisone for injury or illness, and many times they do have that history. If you are having spotting and are on any of these meds, don't stop any prescribed medications on your own. Just don't do that. Check with your provider about the option of changing your meds and see if this will help resolve the bleeding. Certain sexually transmitted infections like chlamydia and gonorrhea can cause abnormal vaginal bleeding, and if these STIs are to blame for your spotting, you would most probably also have unusual vaginal discharge and sometimes a burning sensation during urination. STIs can be diagnosed through testing done at your primary care provider, your GYN, or health department, who can give you treatment options to clear up that infection. If pregnancy is a possibility for you, heavier spotting along with cramps could be signaling a miscarriage or an ectopic pregnancy. And that's when a fertilized egg implants outside of the uterus. Other signs of miscarriage include abdominal pain and fluid or tissue coming from the vagina. Other signs of ectopic pregnancy include low back pain and mild to severe pain in the abdomen or pelvis. Both can be emergencies, so if you are experiencing any of these symptoms during pregnancy, you will want to call your primary care provider or OBGYN right away to get appropriate medical attention. And if symptoms begin after office hours or you're not established with a healthcare provider, you should go to an emergency department in your area. Of course, I can't seem to do any podcast without mentioning stress. Sorry about that. However, physical and emotional stress can take a toll on your body and on your menstrual cycle. Experts and clinicians like me think elevated stress levels can disrupt your cycle's hormone regulation, resulting in spotting. It can also happen with lifestyle changes such as dieting, weight loss, or a new exercise routine. In rare cases, spotting can be a symptom of certain cancers such as endometrial, ovarian, or cervical cancer. With a gynecological cancer, you're likely to notice other severe symptoms such as pain that may get worse over time. If you are already in menopause or have a family history of these cancers, the cancer risk is higher. Any woman who has menopausal bleeding should be seen for the problem. In the last 20 years, my patient population has been predominantly perimenopausal and menopausal women, and during that time, I have diagnosed one cervical, one endometrial, and one ovarian cancer. So it is clearly not super common. Nonetheless, the bleeding needs to get checked out. And while the occasional spotting doesn't usually signal a serious issue, it's a good idea to check with a healthcare provider if you notice any vaginal bleeding that's unusual for you. Before you have an appointment, help out your provider by keeping track of your symptoms. This will really help them figure out what is causing the spotting. And things to include for you to jot down to take to your appointment include details about your usual menstrual cycle, such as the length, heaviness, and consistency of the flow. The length or number of days of your cycle is the number of days between the first day of flow to the first day of flow of your next period. Many women think they are supposed to count from the end of their period to the first day of the next period. No, it's first day to first day. Of course, now there are a lot of apps to track your period, which will calculate all that for you. So if you'd rather do that, that's perfectly fine. Also, let them know when in the cycle does the spotting usually occur. Is it, cycle day 1 is the first day of your menstrual flow. So does the spotting start on cycle day 10, 15, 20? Having that information is helpful. Also, jot down the number of times you've noticed the spotting and any additional symptoms such as cramps, other types of discharge, itching, burning, or odor. Also, let them know about any recent med changes, especially antibiotics or corticosteroids. And if you are on hormonal birth control or HRT, let them know if you've missed any doses and when did that happen. That is really key information. You want to seek medical care as soon as possible if the spotting is severe, persisting, or getting worse, or is linked to other symptoms such as dizziness, fever, fatigue, or abdominal pain, or if it's happening after menopause. One surprising piece of info that I can give you that could help with spotting is that sleeping with a nightlight on can help regulate the menstrual cycle. This is due to the fact that exposure to light has an effect on the sleep hormone, melatonin. As well as controlling sleep, melatonin also controls the release of a woman's productive hormones. A study showed that women with irregular periods who sleep next to an illuminated 100-watt light bulb, which is fairly bright, for 1 or 2 days during the last week of the menstrual cycle had the menstrual cycle shortened by up to 12 days. So a 100-watt bulb on at night for 1 to 2 days during the last week of your menstrual cycle will shorten up your menstrual cycle by up to 12 days. So if you have irregular periods, consider a trial of this technique. Spotting typically isn't a cause for alarm, especially if you recently started taking hormonal birth control or HRT, but there is a chance that it could be a sign of something more serious like a sexually transmitted infection, a thyroid condition, or much, much more rarely, cancer. It's always wise to check it out with your PCP or GYN rather than Dr. Google so they can work it up and help you get rid of the bothersome symptom. Many thanks to Osea for sponsoring today's episode. Please visit our Facebook page, IMB Podcast, where you can leave comments or questions for me. Our website is itchyandbitchy.com. There are blogs with some of our subjects available for you to read there. As always, thanks to Forrest Wenzel, our producer and composer of our theme music, and the person who actually does the work of putting things on the website and Facebook page when I say that we will do this. Thank you, Forrest. Check out his album called An Awful Lot. Go to wherever you stream your favorite music to listen. If you don't know where to stream music, you can find the album on Apple Music or Spotify. Happy holidays, and as always, remember that your health is in your hands.